myself down. Hi guys, and welcome to my YouTube channel. My name is Joanna the Nurse, and today we are going to be talking about another popular topic that a lot of people ask about, and that is just a filler overview. I get so many questions about this, so I just want to kind of address lightly a light overview. All my notes are going to be in the book of Joanna the Nurse, Volume 3, which is a super exciting day because it is my first video filmed with Joanna the Nurse, Volume 3. So let's talk forehead to chin. We'll be talking about filler, but we're talking about neurotoxins as well. So typically for the upper face, I like to say that neurotoxins such as botox, Dysport, Zeman are really popular. So think when you frown. So when you frown, a lot of people have lines right here, commonly called the 11s. And I'm going to be using all layman's terms on this because just to make it really simple. And then so when you frown, you get these 11s. So Botox can just kind of paralyze those muscles. Also your forehead, when you raise your eyebrows, a lot of people do have a lot of lines. So we just kind of want to make that area aesthetic. And then your crow's feet too, when you smile, a lot of people have some lines right here. So by doing a little bit of Botox here and there, drip, drop, drip, it can definitely just kind of paralyze that area. So it's great. So think about neurotoxins being the upper part of your face, such as your frown, forehead, and crow's feet. Those are the areas that's super commonly used. We will talk about some more areas that's used when I start from the because I'm starting from the top to the bottom. The next that's really popular in my practice, not my practice, but the office's practice, is under eye filler. So under eye filler is great for people that have that hollowness under their eyes and just overall want to fill it. I think that it's a great area to fill for people that really need it. However, for people that don't really need it or for people that, are unsure, I do recommend a consultation for that because that area is just so thin naturally. So you don't want to overfill that area and you don't want to fill it if you're not a good candidate. So I definitely recommend coming in for a consultation for that, or just looking to see if you have those hollow tear troughs. You definitely do might want to consider that. Another popular area is nose. I did talk extensively about noses in my last video on my channel, so feel free to watch it. Just a quick overview. So with the nose, non-surgical nose job, it's made only with filler, which is pretty amazing. What it commonly corrects is people with a really low nose bridge that wants to increase that height of the bridge, but also it helps people with bumps. So people that have larger noses but they have a bump, or even smaller noses and they have a bump, you just fill above the bump and below the bump, and it can really camouflage that and look super seamless and super beautiful if done correctly. Another thing it can help is the tip as well. The tip, if you just kind of put it in the right position, it can lift up depending on your anatomy and your skin type. It has become one of my most popular procedures, and I personally love doing non-surgical noses. Okay, the next popular area is cheeks. Cheeks are really popular. It can look amazing. It can totally change your facial structure. I do usually recommend a minimum of 2 syringes, one on each side of the cheek, just because one syringe, you have to think that even one syringe in your lips is a small amount. Think one syringe in your cheeks divided between both areas, 2 areas, and it's dispersed against the largest area of your face. Of course, it's gonna look really minimal, so I do usually recommend doing 2 syringes on your cheeks. But again, it depends on the patient. This is just a broad overview, but usually 2 syringes on the cheek. Next, that's really popular, of course, is the lips. The lips is, I have to say, probably the first thing that I feel that I kept documenting and that I really love doing. I think it can make a huge difference on the entire person's face. I'm very passionate about lips because people always say, I don't want duck lips, I don't want to look fake, things like that. So usually with the lips, it's beautiful when done correctly. Usually I start off with 1 syringe. However, most of my patients do come back for a 2nd syringe just because 1 syringe is not usually as big as people think. So whenever people say, I don't want duck lips, I don't want them to look too crazy, most of the times with 1 syringe, you don't get that look. Even with 2, 3 syringes, you don't. It really just kind of depends on technique, product used, the natural shape of the lip, and also just how many syringes. I have personally 3 syringes in my lips. I love it. I think I could definitely go for another one, honestly, and I probably will soon. So stay tuned, guys, for a video on that. Chin has been getting hot lately, so it's definitely the year of the chin, I like to say. Chin and nose. side profile. So when you don't have too prominent of a chin, it can make the rest of your features not stand out as much, interestingly. So definitely chin is something that a lot of times when my patients do it, it's because I do recommend it to them. Not to ever make the patients feel bad about themselves, but because really the chin is probably the last area that people look at. However, when it's filled, it can change your face. And I think that if you're looking in the mirror and you feel like something is necessary and you can't pinpoint it, most likely it is your chin. So just a little heads up. Another thing that's really popular, and this is going back to the neurotoxins, is doing Botox or Dysport or Zeman in the masseter. This basically what it does is it shrinks your muscle and it causes just atrophy to that muscle. So basically when you bite down and you feel this bulge come out, that's your masseter muscle. So what you want to do is you want to inject some Botox into it and you just kind of want to break down that muscle. This is very popular in my practice. I do think it gives like a slimmer look, and it's something that I personally have been doing it for many, many years, and I love it. So it's something I do recommend to a lot of my patients that are looking for that V-line look. Another area that Botox is used is to kind of give you a dimple chin. Not to give you a dimple chin, but to help with the dimple chin. So basically when you like purse your lips and you have these little holes in your chin, you can actually do a little Botox there and it will help that area. Another reason that Botox is good for is when you have a gummy smile, when you smile and your like gums are a little bit higher, just trying to drop that muscle a little bit and you can kind of cover up that gummy smile. You can also use Botox to give you a little bit of a lip flip. That's usually something I recommend for patients that don't have too much of a lip show. It's kind of inside their mouth, so when you just kind of bring it out a little bit with Botox. And when I say Botox, Dysport, and Zeman, those are all 3 different name brands of it. However, they all fall under the neurotoxin category, but they are all very similar. Botox, Dysport, Zeman lasts on average to 3 to 4 months. The average cost, just depending on what you do, can range from $100 to $1,000, just depending. Most patients in the practice I work at spend on average about $300 to $600, just depending on, again, the areas that they want. Fillers, also the duration can last different based on your patient, the metabolism of the patient, their lifestyle, and also what filler you use. So something like, I don't want to do brand names just because I want to make this video very generic, but one filler that I do in the lips is going to last a shorter time than the filler I do in the cheeks or in the nose, something like that. So you have to keep in mind that whenever you go in for a consultation about injections, just know that there are so many different fillers. There's not one filler that fits all. Yeah, and I love all fillers, and I go over kind of an in-depth consultation with all of y'all when you come in. So that's why whenever people ask me questions like online, if I'm a good candidate, I always say, you know, it's best that you come in, that way I can properly assess you. One question I get asked often is, what if I hate it? If you hate fillers, there is something you can easily do, and that basically if you use a filler that is a hyaluronic acid, which is a lot of fillers, then you can dissolve it with something called hyaluronidase. It works in about 24 to 48 hours. It works well. However, you know, unless you really hate your fillers, or unless, you know, an accident has happened where that causes you to have to dissolve your fillers, because of course safety always comes first, then I don't usually recommend doing it, especially if it's been less than 2 weeks, just because that filler really needs time to settle. So if you feel like your lips are too big or something like that and you want to get them dissolved, just know that I do recommend waiting a little bit, because really it's still swollen. Botox, Dysport, Zeman, a neurotoxin, you cannot take away, you cannot dissolve. However, it does go away in 3 to 4 months. Let me make sure I got everything. So my final words of advice is, if you're contemplating it, you know, you have the money for it, you're sure of this decision, try it. It goes away, it's not permanent, and chances are you will love it. I have had many patients that are so nervous coming into it, they don't really want to do it, but their friend is pressuring them, or they just kind of want to try it out purely out of curiosity. But in reality, they love it. A lot of my patients are long-term patients, and I am so grateful for them. So again, if you are interested, just come in and try it out, and come see me, Joanna the nurse. And I hope you guys really enjoyed that video. Feel free to leave comments and feedback down below, and I will see you guys soon. Bye. It's called, ooh, my foot's asleep. Ooh. Top head to chin, forehead to chin. I want to talk about, so let's forward to chin.
Why is it forward?
Oh, really? Yeah. Are you sure I said that?
Yeah, I swear.
Julie?
Yeah, you said forward.
Oh, fuck, okay, hold on. It's like the bright light.
I know.
Poor Stephanie, she has so much to. So when you don't have a chin, I'm sorry.
When you don't have a chin.